Hey, Steve.
Hey, Ellen, how are you?
I'm good, thank you.
How's the family?
Excellent. Thank you
Good.
for asking. I've appreciated your help over the years with this patient that I have, Mark. You might remember him. We diagnosed him about almost 3 years ago, I guess, with Alzheimer's. Started him on donepezil. Didn't have much of an effect. A lot of side effects. He's had a progressive decline, as we would suspect. I ordered VNA services to go out, give him some physical therapy, and the VNA actually called me yesterday, and the visiting nurse is concerned about his safety, about staying home. Right. Not only the falls, but some behavior issues, and unfortunately, Jill, his wife, was just diagnosed with a seizure disorder.
Oh my. So
things are not looking good. And I've discussed with Jill her options in terms of, placement in assisted living or a skilled nursing facility. And up until now, she's been adamant that she really wants to care for Mark at home. But I think with the seizure disorder, I think that kind of has really been the straw that's broken the camel's back. And so I'm going to go out tomorrow to make a home visit, assess the situation, and I just wanted to run things by you to see at this point, what you think I should be doing in terms of advising the family, anything else I should be assessing with Mark, and any help you can give me, I'd appreciate it.
Well, at this point, we're really focused on thinking about trying to preserve some sort of quality of life, and then also trying to preserve whatever relationship still continues between his wife, who's the caregiver, and him. And one of the things that really at this stage in dementia, compromises that so much is when it passes beyond the ability of the caregiver to continue to care for the person at home.
Sure.
And I don't know whether she has the financial capacity to bring in additional assistance into the home. That's one thing to think about. But before you even think about that, it's really important, and I hope that you've had the conversation with him and the family about what you want to do around if he has some sort of either catastrophic event or he becomes really very cognitively impaired, and what you want to do about maintaining life or continuing life. Have you had that conversation with the family around feeding tubes and things like that?
So initially we had a standard advance directive, but we have at the last visit we completed a post.
Oh, great. Okay, so that's really important because, as you know, kind of determining those goals of care with the healthcare proxy around what you want to do, and making sure that if in fact he and the family, in early on he's expressed a wish not to have intensive treatment, which usually is what we recommend, not having feeding tubes, because those really don't prolong life. They actually often result in pressure ulcers and all sorts of downstream complications. So palliative, supports around helping the person to be as comfortable as possible is really what we recommend, and thinking about maintaining the quality of life not only for him, but very importantly for his wife at this point.
Sure. And these things, as you know, have sometimes some complications in terms of finances, and so my recommendation, of course, is for him to work with a care manager at the aging center, and possibly see an elder attorney, and because it can become real complicated. What is your thinking about some of the memory units in the assisted living facilities?
Yeah, I think increasingly assisted living facilities have become more and more capable of having memory units, and so we used to have everyone go to nursing homes, skilled nursing, expensive, not as home-like often, sometimes more institutional, and some of the memory units, particularly in our area, there's some that we could tell you about in our resource center that are really very, very good, and can continue to have some semblance of a home-like environment in the context of a assisted living, as long as a person can continue to ambulate and do some of their ADLs. Once you go beyond that, it's beyond the assisted living, and you're really left with a skilled nursing unit and hopefully a memory unit within a skilled nursing facility as the option.
Right. So I had been actually talking with folks at the Aging Resource Center, and one of the things that they mentioned was if he does have function of some of his ADL, that an assisted living placement may be very helpful at this point, and then he could progress and move to hospice at the very end stage, and completely avoid you know, a
Yeah.
skilled facility.
Yeah.
So that's some of the options that I know, you know, that have been.
Yeah, that can be really good. In fact, that's exactly what we did with my mother, actually, who had Alzheimer's, and we were able to kind of have her stay within the assisted living facility with some memory unit support, and never ended up in hospice and
Right.
didn't have to do that. So I think, you know, again, that's obviously optimal. It's worth kind of thinking about the financial issues. An elder law attorney can help with this issue, as long, you know, in addition to some of the resources we've described.
Right.
But it does sound like you're getting to that point, you know, and often some of the things that really kind of trip the balance are the things you've described, that the caregiver has declining health. In this instance, she's got a seizure disorder that's really become unstable, and if that happens, or sometimes the person develops substance abuse or cardiovascular disease, or a whole bunch of things can happen because of the stress of caregiving is huge.
Sure.
So caregiver breakdown, one of the major things that launches people into nursing homes. Another thing is, and I asked you about incontinence, but certainly once someone gets incontinent and regularly incontinent, it often triggers nursing homes, but certainly falls, as you mentioned, is another
Right.
one. It becomes a danger issue. And then also in the safety areas, this issue of behavioral agitation. If he's getting physically assaultive and she's at risk, it's a point too where probably the home environment is not safe any longer, and you really need to think about finding a placement that's going to be helpful for
Right.
them, for him and the family.
Sure, sure. Well, listen, thanks. I appreciate your help.
Sure. Hope it goes well.